This is the second module in a series of training videos about the business of the eye care service. Module 2, the Vision Centre. The learning objectives for this module are understanding the role of the Vision Centre, identifying the goals of the Vision Centre, understanding the need to move towards financial sustainability and strategies to get there, how to deliver the service and the inventory requirements, and the need to monitor and evaluate delivery, outcomes, and the impact of the service. There are several aspects to achieving a successful Vision Centre. Firstly, it must ensure that it delivers comprehensive eye care, not a reduced service. This means not just refraction, but also eye disease detection, dispensing and glazing of glasses, and referral for further interventions as required. It must mobilise the community, increasing their sense of ownership, and at the same time increase awareness of both eye care and eye care services. These last 2 points mean using information, education, and communication to involve the local community. It has to improve accessibility to its services, which means offering the service at the Vision Centre at the expected times, along with outreaching to those people who are unable to attend the Vision Centre. And it must improve quality of care for the unreached. This means offering a comparable level of service to patients serviced on outreach and those in more neglected groups, such as females, the very young, the very old, the disabled, etc. In addition, a Vision Centre also needs to increase patient flow through marketing and word of mouth, improve the ratio of paying over subsidised patients in order to ensure financial sustainability. We can achieve this by having glasses of higher value available for those who both want and can afford them. For example, higher value frame styles, progressive lenses, photochromics, etc. The Vision Centre should also enable the eye care institution to make an impact on people's lives. And it must develop structure and the capacity for future growth by creating robust operational systems within the service that allow for expansion. A Vision Centre needs to have goals to work towards. The goals of the Vision Centre are to increase the uptake of eye care services, to offer permanently available comprehensive primary eye care to the population, and to create awareness and educate the community about eye health and potential problems. There are certainly barriers and misconceptions around eye care. The presence of a permanent, community-based Vision Centre can address these issues. Often there is a lack of awareness about eye health and eye care services. Awareness is raised by ongoing information, education, and communication. There can be a perception that cost of seeking treatment for poor vision would outweigh the benefits. This can be disproven by having a local, affordable option at the Vision Centre Involving the local community in the work of the Vision Centre increases uptake of eye care services. We should engage community leaders to take ownership of the problem of visual impairment in their area. We should sensitise them as to how the Vision Centre facility can be used by the community, and arrange public meetings where the eye care team can interact with the community. The ultimate financial goal of a Vision Centre is 100% cost recovery. This involves ensuring that products provided to Vision Centre patients are not free of charge, that patients must pay for any necessary medicines or glasses, and understanding that higher volumes of patients mean more revenue for the Vision Centre. Demand generation is achieved through marketing, engagement, and promotion, and is also one of the roles of outreach. In addition, more advanced lenses, such as varifocal, bifocal, and photochromic, command higher fees and should be available, possibly to order, and be glazable at the Vision Centre. This increases revenues by avoiding loss of sales elsewhere and offers patients the convenience of a same-day service, which leads to loyalty from satisfied patients. And it is important to keep monthly expenses low while still ensuring high-quality eye care also. This is about getting the balance right between overspending, which affects cost recovery, and underspending, which reduces overall quality in the service. Performing all of these actions will help the Vision Centre to move towards financial sustainability. When it comes to delivering the service at the Vision Centre, it is important to realise that uncorrected refractive error is the second major cause of preventable blindness globally, and is therefore a priority. Indeed, it is the primary role of the Vision Centre, and that it is important to provide a comprehensive service. This means refraction, disease detection, and affordable dispensing and glazing of spectacles at the Vision Centre, so full care is accessible to the community. To deliver the service, the Vision Centre must have trained people to refract and provide counselling about refractive error and eye disease, equipment for eye examination, vision testing, refraction, and spectacle dispensing, all of which must be properly maintained, and spectacle options which are acceptable and affordable to the patient. Given the very low coverage and penetration of existing primary eye care services, a Vision Centre should certainly cater to those who visit it, but also proactively seek out those who need correction. This involves marketing the Vision Centre and is dealt with fully in a separate module. Several items should always be stocked at the Vision Centre. These include frames. There should be a variety of frames available to satisfy personal and local preferences. Male and female, small and large, statement frames, and more subdued styles. Many people are willing to spend more on an attractive pair of spectacles. This can help provide the required income to sustain the services of the vision centre. Remember, smaller frames need to be available for children so they aren't neglected. And sunglasses should be available, with lenses of a sufficient quality to protect patients' eyes and of a style that people would want to purchase. Lenses. Only commonly required diopter powers should be stocked. Other lenses must be ordered. We don't want to tie money up in lens stock that is unlikely to be needed. Higher value lenses, for example varifocals, photochromics, help greatly towards 100% cost recovery. Also, keep an inventory of roughly 10 times the expected number of orders. With good inventory planning, on the spot dispensing of about 85% of orders should be achievable. Finally, keep a stock of ready-made spectacles, cases, cleaning materials, etc. Monitoring and evaluation are essential aspects to running a successful eye care service. Monitoring is an ongoing review of what is being done, while evaluation is a one-time activity that looks back on what has been done and achieved. Then we can decide whether we are on the right track. It allows us to measure our achievements and progress, and most importantly, to detect challenges and problems in time to take necessary corrective action, which in turn helps to improve outcomes and enhance the impacts of the eye care institution's work. And it ensures optimal utilisation of resources. Monitoring and evaluation also helps to improve staff performance and day-to-day decision-making by giving feedback on their efforts. It stimulates learning and motivation for training, while building understanding and capacity among staff. And overall, it develops the strengths of the personnel of the eye care team and the institution as a whole. It helps improve efficiency and effectiveness, and also helps in planning. It demonstrates accountability and maintains control over finances. And very importantly, it provides proof of success to funders, stakeholders, and governing bodies by showing that their money and other resources have been spent in the best and most appropriate way. Here is an outline of the monitoring and evaluation process. Firstly, determine the clear objectives of the project at the beginning, including a budget for the expected expenditures. Then plan the activity. Select the performance indicators that you want to use and develop the standards that you will accept. Start to monitor the project and how it is implemented, and continue monitoring throughout. Later, we move into the evaluation phase, usually when the project is complete, or before that if problems develop. And we compare outcomes with the project targets that we set at the start. Then we must analyse and disseminate our findings. And finally, most importantly, take corrective action based on the successes or failures that we have found. Some of the performance indicators that we choose might include number of outpatients seen against the target set, age distribution of patients, are we seeing an equal turnout from all the age groups, number of manufactured glasses and ready readers delivered against the target, the glasses acceptance rate, the take-up rate after advising glasses are needed, the total number of outpatients with an eye defect, such as cataracts, glaucoma, diabetic retinopathy, etc., the number of cases referred to the base hospital for further intervention, the referral acceptance rate, how many take the advice to seek further intervention, visual acuity outcomes, for example, the number of patients who gained visual acuity with correction of 6.6 to 6.18. There are some common challenges when monitoring and evaluating, which include unclear objectives of the programme by not being specific about what it is to be achieved, undefined key performance indicators through a lack of clarity about what should be collected and measured and when, uncertainty about who is responsible for the data by failing to assign responsibility, poor or improperly reported data from many sources by not setting standards for the gathering of data, lack of systems in place for analysis and storage of data. Data should preferably be stored on a spreadsheet program such as Microsoft Excel. Unstructured information distribution and use through a lack of action in response to what the data tells us. More challenges include lack of analytical skills in the team, lack of interest and team spirit, lack of coordination with other departments through poor communication, autocratic ways of monitoring. There has to be an agreed team standard, not left to an individual to decide their own way. A lack of management support, or no mandate or capacity to take appropriate action after evaluation, which leads to wasting what the data is telling you by not acting. That concludes Module 2 on the Vision Centre. Next in the series is Module 3 on Human Resources in the Eye Care Service.